Hi everyone, good morning and good evening to some. We are doing this live session. Hi Claire, we're doing this live session with the request of you all. Many of you have requested me to do this live session about MS and COVID vaccines. Yes, I can see the doctor is also here, so I'll just join him immediately without wasting any time. Yes. So this is on the request of you all that we have arranged a session with Dr. Darren Ingles today, and he'll be talking about COVID vaccines and MS. Good morning, doctor. I think we're having a little lag problem. Let's wait. Good morning, doctor. Can you see me?
Nope, good morning, Ritu.
Okay, fine. This is being corrected. Good morning, doctor.
How are you?
I'm good. How are you?
Oh, good. How's everything out in Mumbai?
Everything is great here, and people are just going crazy about the new vaccines being developed in India
Yeah.
also. So, which is a big breakthrough. How are things there at your end? Hello? I think we are having a lot of internet lag here,
I'm sorry,
doctor.
I'm getting a little bit of a lag on my end.
Yes, yes, yes. Let me do one thing. Let me disconnect and connect you
Okay, sorry
again.
about that.
So
Yeah, I
maybe
think,
that would sort out.
okay.
Let me try. Okay, such things happen when we do in our life. It's not the first time, anyways. So yes, so what we were talking with Dr. Darren Ingles was about COVID vaccines and its effect on MS patients. We've seen that the Wildwood endeavor to create safe and effective COVID-19 vaccines is bearing fruit now. Hi, doctor. Can you see me well now? Can you hear me well?
Is that any better?
Let's hope so. I have to wait for a minute, but it's okay as long as you can hear me.
I can hear you.
Oh, great. So how are things at your end? What's going on there with regards to COVID?
Well, in California, we're still on lockdown, so we're pretty much where we were back in March.
Oh my God.
We had a huge increase in cases, not just in California, but actually around the country. So our governor basically shut down restaurants again, shut down hair salons, shut down gyms. So people are pretty much staying in home as they were, pretty much when this thing first started.
Oh my God. So I can say in US and UK, there's a second lockdown. Oh my God, that's
Yeah.
dangerous. It has not been announced in India yet, but hopefully it doesn't happen.
Yeah, it's unfortunate, but I know everyone's trying to be as safe as possible, and it's just, if we kind of go back to using Spanish flu as a template of what we've seen with COVID-19, the same
Yes.
exact thing happened. It happened three waves over 18 months, and we've pretty much seen kind of the same course of action with COVID-19. So I suppose the good news with that is that if that follows the same pattern, really by the end of spring, we'll probably see this virus start to peter itself out, and we won't see very many cases anymore. So fingers crossed.
Let's keep our fingers crossed, exactly. The good thing is that the vaccines are being developed. But the dangerous thing when we think in our minds is that usually it takes 7 years and 6 years to develop vaccines. And
Yeah.
here, what we are doing is rushing into things because the entire world needs it, of course. But what do you think about the vaccines, the way it is being developed now? Do you think it's going to be effective?
Well, it's hard to know. And, this is part of the problem with vaccine science is that, like you said, it takes years to develop a vaccine so they can adequately test it for any potential long-term effects. How long does the vaccine last? Is it effective at actually preventing the disease you're trying to treat? And, they just didn't have time essentially to do that work. So, we have about, most of the studies from Moderna and Pfizer were about a 2-month study where, we know that, they patients who got the vaccine had a robust immune response, which is what you want from a vaccine. However, they didn't do the study long enough to see, does it actually prevent the spread or seriousness of COVID-19? Now, at least in the 2-month study, for those who've gotten it, seem to have gotten less COVID-19 or less severe illness. So based on that limited data, there does seem to be some element of benefit of at least reducing the severity of disease if people do get COVID-19. But I think it's important that people understand that, this technology being used with both the Moderna and the Pfizer vaccine is an mRNA vaccine, which we've never used in vaccine science before. So there are a lot of unknowns about, what are the potential long-term effects, if any. We know so far as they've unrolled it, at least in the United States, that there's about a 3% chance of having an allergic reaction to the vaccine. Mostly, and I'm sorry, I'm forgetting whether it's the Pfizer or Moderna. One of them uses PEG, polyethylene glycol, in the solution. And the speculation is that the PEG, because it is a common allergen, that may be what's triggering this allergic reaction. But, 3% is actually a pretty high number. And when you start talking about, giving millions of people this vaccine, that's a fairly high number of people that will need medical care to treat the allergy to the vaccine. So, the CDC is basically, in the United States, has issued a statement that, when you give the vaccine, be prepared for allergic reactions, and whether that's Benadryl or an EpiPen, just for that population of people that might have an adverse reaction to it.
Yes. So, like it was being said, that what will be the side effects of the vaccines? They say, like you have normally in flu, you'll have cold, you will have headache, you will feel nauseated, and those effects will be there. But the difference comes when we talk about normal people having reactions and the people already having some kind of disease like MS or fibromyalgia or the other diseases, their reaction in their body with these vaccines. Is there any study being done about for those people already having a condition like this?
No, unfortunately, because again, the limited time that they've had to develop these vaccines, there's no way to really extrapolate it to various populations. So, this was basically tested on, I'll say, a relatively healthy population. It hasn't been tested in women who are pregnant. It hasn't been tested in other populations. So again, we don't really know. I think there's always a concern with anyone with an autoimmune disease. Now this vaccine is different in the fact that, the biggest difference between pretty much every other vaccine out there and an mRNA vaccine, when you give other vaccines, is you give little particles of the virus, most of them are viral, or the bacteria, so that by introducing small amounts of it to the immune system, it elicits this antibody response. So if you do actually get exposed to the organism, your immune system reacts much quicker. With an mRNA vaccine, there's no viral particles at all that's introduced. It's a technology that's designed to get into your cells, induce a change in the DNA so that your own cells make antibodies against a specific protein with the coronavirus. So the fact that we're not introducing any viral particles at all does make it a little bit different than pretty much every other vaccine out there on the market. So again, it is a different technology. So from that perspective, what I'm hearing for people who've already gotten the vaccine, again, pain at the site of injection is common pretty much with everybody. They all say their arm hurts for several days afterwards. Some people have gotten flu-like symptoms. Again, there's about a smaller percentage of people that have had like legit anaphylactic reactions to it or some sort of allergic reaction to it. So, side effects, I guess I could say, are more common probably than with other vaccines out there on the market. But I think, the biggest question mark we have right now is, what are the potential long-term effects, particularly in a population of people that have an underlying autoimmune condition? Is it safe? Is it effective? Is it going to induce any other type of change? And the truth is we just don't know yet. I think, I hate to make a blanket statement that everybody with an autoimmune disease is at risk. I don't believe that's necessarily true. I work with a lot of people with autoimmune disease that are reasonably healthy. They don't have a lot of these comorbid conditions that we know are risk factors for COVID-19, such as obesity, diabetes, history of a smoker, and so forth. So, there's a lot of very healthy people living with an autoimmune disease that are probably at relatively low risk, and also depending on your age. But there are other people who are older, who have an autoimmune disease, who might be overweight, who are on a disease modifying drug that suppresses their immune system. And this is a population where, the vaccine may make more sense for them. So I think it's really important that everybody knows, you got to talk to your doctor about, what are your risk factors. Again, instead of making a blanket statement that everybody necessarily needs the vaccine, everybody doesn't need the vaccine, it's really individual. And I think, everybody just has to look at their own individual risk factors and make that decision about whether it's really right for you. Look, what's probably going to happen anyway, again, all viruses, all pandemics have a finite period to them. At some point, this virus is going to integrate into our society. It's not going away, but it won't be as virulent as it has been over the last, year plus. So we will get to that point. It's just how long is it going to take to get there? And in between now and then, what is your potential risk for, getting COVID-19? So again, I think this needs to be a very individual decision between you and your doctor about, whether you are at higher risk. We know from looking at the global data out there that the overwhelming majority of people that have been hospitalized and certainly died from COVID-19 have been an older population, particularly with comorbid conditions, and they account for the overwhelming majority of hospitalizations and deaths. So, for people who are in that category, it makes a lot of sense because I think the risk of the vaccine is less than the risk of getting COVID-19.
Exactly.
But if you're a younger, reasonably healthy person that don't have any of these comorbid factors, that risk may be less. So, again, I think you just need to have that discussion with your doctor about, whether it's right for you.
Right, because otherwise also the other medicines, like we say about the DMT is available for MS also. That is also very individualized. Not every DMT suits everyone. For example, even the flu shots, not everybody likes taking flu shots. They get reactions. So maybe their doctor know about their body, their history of their diseases or any kind of conditions, and they can be able to help you much better to understand whether you should go for these medications or not. This was a question being asked by many of them who said that can MS patients have COVID vaccines? Yes, you need to speak to your doctor. Doctor, I was reading this article and which said that BioNTech CEO, Mr. Shahin, he led a research showing an mRNA vaccine worked in mouse models of multiple sclerosis and said the symptoms became better or even more tolerable. So like you said, there has not been any people with autoimmune disease, the vaccines are being tried, but they have done the test on the mouse, on the rats, to say so.
Yeah. It's fairly interesting. I mean, I think just a little history lesson. We collectively, being the scientific community, have been trying to develop a coronavirus vaccine for 30 years. Coronaviruses as a whole account for about 15% of what people think they get as flu every year. So it's a major cause of upper respiratory infections and flu-like symptoms, and this has been true forever. But in 30 years, we've never had a successful vaccine. In animal studies, after they give the animal the vaccine, they get this robust immune response. And as soon as they expose the animal to the virus, the animal gets very sick and in some cases even dies. It actually induced a cytokine storm, which is what, has happened in the hospitals with people who've died, is that they get this cytokine storm, this overwhelming immune response, and just can't control it. So, again, this is a different technology, and maybe that doesn't pose the same risk as these previous trials. But I just do find it interesting that in 30 years of trying to develop a coronavirus vaccine, we've never had a successful one. Now, in less than a year, we've got 6 coming to market. We have 2 approved in the US right now. I think there's 4 other companies that are trying to get approval through the FDA. And, it's, again, I think there are a lot of question marks. I just saw a question scroll through, and I thought it's a great question. If I've already had COVID-19, do I need to get vaccinated? Absolutely not. I've run into this with a few doctors I've heard who said, oh, you should get the vaccine anyway. I'm like, no, your natural immunity to having had COVID-19 is much greater than anything you're ever going to get through a vaccine. There are 4 major proteins associated with this coronavirus vaccine, or coronavirus that's out there now, the SARS-CoV-2, 4 major proteins. And they talk about this M spike protein, and that's what the vaccine is really targeting. It's trying to induce this antibody response to the M spike protein. But there's 3 other proteins associated with this virus. And we also know that part of your long-term immunity is actually induced by T cells. So antibodies are made by B cells. It's a different part of your immune system. And so when you get it naturally, you get antibodies to all four of these major proteins, and you get the T cell immunity. And what the research is showing so far is that the T cell immunity is really what's giving long-term immunity. There was just an article published this week that suggests that people who get coronavirus, the COVID-19 naturally, are probably immune for years, where with the vaccine, we really don't know how long it might create immunity. If it's anything like what we see with influenza vaccines, you may get a season of, immunity from it, but then next year you're going to have to get another shot because the virus, mutates to the point where, it's something a little bit different. So if you have already had COVID-19 and for sure, I mean, you had the symptoms, you had a positive test, it doesn't really make any sense because really the benefit of a vaccine is for someone who hasn't been exposed to protect them from getting serious illness if they do get exposed. But for someone who's already been through it, their body has naturally made that. There's no situation in the world that I'm aware of where a vaccine is more effective than getting the bug naturally. This is true for measles, mumps, rubella, chickenpox. Mother Nature is always smarter than pharmaceutical science when it comes to this because the immune response is so much more broad and covers more than just giving the vaccine.
Right. So, doctor, I'm also seeing that there's so many questions like people are asking. Someone is on Tysabri, so the other person would be on Ocrevus, which is immune suppressant drug. The other person is Avonex and all that. So what do you think? People with different kind of DMTs, can they take these vaccines, whether it is immune suppressant or not? How does it work for them specifically? Or do you think that person without DMT will do better with vaccines, or a person with DMT will do better?
Yeah, I don't think it's as simple as you're on a drug, a disease modifying drug or not. I think it's a function of all the other risk factors associated with your health. I don't think that people who are on DMDs by themselves are necessarily at much greater risk. There is some increase, but what we're seeing so far in populations that are on disease modifying drugs, and understand this is almost all anecdotal data. There's no real study behind this. But if you look at like frontline workers that have lupus, that have rheumatoid arthritis, that have these other conditions who've been getting the vaccine, we're not necessarily hearing through the grapevine that there is a higher incidence of problems in that population. But again, I think you have to look at the overall health of the person. So, and I am concerned for people. I mean, I'm on Ocrevus. I got COVID-19 very early in the season. I had it for about 2 months of coughing and hacking. So I don't plan on getting the vaccine because of that. But, being someone who is working with patients all the time, if the situation is different, I might have a different opinion. But I think for those people who, are frontline workers, if you do have, an autoimmune disease and, you are at higher risk, and you haven't had COVID-19, again, it might make sense. But if you're not in that population of people and you're otherwise reasonably healthy, you're not overweight, you're not a diabetic, you're not having these other factors. I mean, it's very interesting in my own patient population, so in the now really year that we've been dealing with COVID-19, I have literally had one patient in my practice who's been hospitalized, and they were in the hospital for 4 days and released, and now they're fine. Everyone else I've dealt with that's had COVID-19, when we support them nutritionally, and there are a lot of other therapies out there for COVID-19, and particularly when you catch it early, have been incredibly successful at preventing hospitalization and certainly death. So I kind of feel like, if you're working with a functional medicine doctor, naturopathic doctor in particular, we have a lot of tools to deal with COVID-19 if it does happen. Ultimately, if you are someone who has a lot of these risk factors, a lot of these are diet, lifestyle mediated. There are things that you can do that will help modulate that. If you're really overweight, you need to lose weight because you're not only at risk of COVID-19, you're at risk of a lot of other things. So if we're talking about getting your overall health improved, then, you got to look at, what you're eating, how you're living your life. And, there's a lot of these changes that people can make. And I just find it interesting in this whole year, I've yet to see a single media outlet that's really promoted, eat better food, Get sleep, get
Exactly.
vitamin D. We know
Yes.
that vitamin
Yes.
D, deficiency is a major risk factor for death due to COVID-19. So you're telling people to shelter in place. Well, tell people to get outside in their homes and get sunlight because the
Vitamin
vitamin
D.
D is
Exactly.
essential for
Yes.
good health. And
Yes.
nobody's talking about, and of course, I think, the reason the United States and maybe even in the UK that we've had a proportionally higher number of cases is that we're just an unhealthy society. Most of America's fat, to be honest. And, knowing that, this excess, fat mass is a risk factor, I said, not just for COVID-19, but for a lot of other diseases, including heart disease and cancer, diabetes. You can get your overall health improved by taking stock of your own life. And
Right.
nobody in the media has promoted that at all. So unfortunately, it's kind of disappointing. And we've kind of, put so much, we put the vaccine on the pedestal that this is going to be what's going to stop the pandemic. This is what's going to be to cure the world. And
Mm.
we don't even know that. And the reality is, at least in the US, the unrolling of
Exactly.
the vaccine has been extraordinarily slow. The reality is the general population in the US probably won't even see the vaccine until late spring, early summer. So by then, this virus will probably be mostly done based on at least what we expect with, Spanish flu. So if that's the case, uh, we'll see what happens. But I think, it's been this past year because of everything going on. It's really been a good opportunity for people to really take stock of, because most people have had more time on their hands.
Mm-hmm.
Now you really have time to be home and cook your own food. Now you do have time to get that walk in or get some more exercise.
Exactly. Yeah.
And I think some people have really taken advantage of that and other people
Mm.
haven't. So I'm hoping kind of moving forward that we'll see on a global level that there's more effort to get people healthier. And that's going to help prevent a lot of these situations. Because look, this won't be the last pandemic, certainly in my lifetime. We know about every 10 years or so, something emerges and we will see another pandemic again. Will it be to the degree of COVID-19? Who knows? But, history has shown that these, viruses and sometimes bacteria do emerge, cause a lot of illness. If you kind of go back to Spanish flu, I mean, at the time, it literally killed 5% of the entire world population.
Exactly.
So fortunately,
Yes.
COVID-19 has been not even
Yes.
remotely close to that. But I mean,
Yes.
we do have a history. I mean, there was a time with the plague and tuberculosis, it killed a lot of people.
Yes.
So, this does happen in history. It will probably happen again. So if we really want to prepare for the future too, is that, we just, need to be as healthy as possible. And certainly
Mm.
for those of us with MS, other autoimmune diseases, we need to do everything we can to make our train as hospitable as possible to help with cell growth, cell repair, and as least hospitable to, pathogenic microbes as much as possible.
Yeah. This was the point in my mind also, that everybody's saying, oh, we should have vaccines developed soon. We don't have COVID vaccines, and the world is running after vaccines. But nobody's talking about naturopathy things, how naturally you can actually treat COVID. Like, there are people who are not taking MS medications, but they are trying to treat themselves naturally. Like you yourself have been on natural diet and exercises for years, and now you're taking Ocrevus. And I'm sure it must not be for long that you'll go
Yeah.
turn again on natural way. So there are people who actually trust and believe that natural ways of healing us are much better. And till the world doesn't get access to vaccines properly in a 100% manner, there are things which they can do naturally. Like you said, vitamin D, vitamin C, go for a jog, exercise. All those things are also necessarily, which will not only help them from COVID, but also for MS and the other problems. So, which is a very important statement that you have made here today. And yes, so people are saying that they're taking 8,000 IU of vitamin D and 4,000 in spring and summer, which I think is a fair amount.
Yeah.
Dr. Dev got a very interesting question here from Scorpio. And she has written that, what do you think are the ingredients of this vaccine? Is there mercury, aluminum, aborted
No, there
fetuses?
are no. I mean, the one good news is there's no adjuvants in either one of the Moderna or Pfizer vaccines. They don't need them. So yeah, there is no mercury or aluminum, as far as I'm aware, in these vaccines because you don't need them because those are typically adjuvants that are added, and they don't need that for this type of vaccine within an mRNA vaccine. So the good news is you don't have those kind of things in it. But again, you do have things like PEG. No vaccine is ever completely clean of no chemicals, no anything. I think the greatest risk is what we've seen so far is that, some people are probably allergic to some of the
Mm,
components in these vaccines. And
exactly.
the ones that will be coming out, in the future, I haven't had a chance to see, their package inserts to see, what they're going to be comprised of. So, it's the nature of any vaccine is that none of them are, completely clean. And
Mm,
inevitably there will be some population of people that do have problems with some of these other ingredients in it. So, you know, again, if you know that you are an allergic person, um,
mm,
I think you have to be very careful. And certainly, if you were going to get vaccinated, you would definitely want to make sure that they had the proper equipment there to deal with an allergic reaction if it did happen. And
mm.
yeah, it's just something you just have to be cognizant of.
Yes. Doctor, I know that you said that the pregnant women are not being tested with this COVID vaccine. But what if any pregnant woman comes and asks you that, can I take this vaccine? What can be the best answer for her? Because she cannot be just homebound forever, like,
Yeah,
in lockdown forever, when she needs to move out and live her life. So what do you
yeah.
think? Apart from the precautions taken, is other vaccines safe?
Yeah, I mean, we don't know, and that's the thing.
Mm,
My
exactly.
feeling, for pregnant women, it's actually not indicated in pregnant women. They've actually come out and said it's not indicated for pregnant women and women who are breastfeeding. So
Wow.
I do know there are pregnant women who have gotten the vaccine, but that is actually not recommended even by the CDC. So I would be very cautious if I was a pregnant mom. I would be very hesitant to get a vaccine because, again, without any data at all in how this
Exactly.
vaccine may affect, mom or baby, and it's one of those things that, once it happens, you can't undo it. And again, I think you have
Exactly.
to look at, certainly your age. I think, most pregnant women, because you can only be pregnant in a certain time of your life, you are in a
Exactly.
younger population and therefore you are at lower risk because of your age. Now, whether you have, again, some of these other comorbid conditions, that's a little bit different story. But I think, again, the fact that there's been no data in pregnancy, I would be very hesitant if I was a pregnant mother.
Very, very, very said. Doctor, I have a question by MS Sister Spoonies. She has written that Cuba has started using nasalfaron to prevent the reproduction of the virus in patient's body and also to build immunity. What are your thoughts on that?
I am actually not familiar with that work in Cuba, so I don't know. Yeah, I haven't
Right.
seen that yet.
That's okay. Okay, so moving on to the other question by MS Makes Diamonds. He's written, due to my second Ocrevus infusion in February, one of the main concerns is upper respiratory infection. Assuming COVID would amplify this, will it?
Will I'm not sure I'm understanding the question. So is he asking, would Ocrevus make him more at risk of upper respiratory infections?
Yeah, because of her second Ocrevus
Yeah.
infusion, the major concern that he's having right now is a respiratory infection.
Yeah,
So,
well, I mean, that's what Ocrevus does. I mean, it does, suppress the immune system. Although the effect of Ocrevus is it doesn't happen immediately. So even when you get your first Ocrevus infusion, it takes about 3 months for the medicine to fully kick in. With the second infusion, it'll be a little bit faster, but it's not, as far as I'm aware, immediate. So there is a risk of any type of underlying infection. Again, my feeling, my own experience with Ocrevus, I mean, I take a lot of supplements to help support my immune system, other
yes.
parts of my immune system, because Ocrevus very specifically works on B cells. So again, it's trying to suppress the antibody response. So I'll take other things to help support my T cells to try and prevent. And, knock on wood, I'm actually due for my second infusion in about a month. So, it's I will load up on, more nutrients around that time as well to help support my immune system. So I think, when you're due to get your infusion, your injection, particularly for some people who are on some of the injectables where they often see that right after their injection, they feel pretty crummy for the next few days. It's a good time, maybe, 3, 4 days, even up to a week prior to your injection to really load up on, nutrients to help support your immune system. And there are other herbs as well. I mean, mushroom extracts, things like
Mm,
shiitake, reishi, work really well supporting, natural killer cells and T cells. So again, you can talk with your doctor about what might be appropriate for you, but there are ways to help support your immune system in other ways to hopefully, offset the effect of that disease modifying drug so that it's not kind of leaving you more at risk of whether it's COVID-19, influenza, any other, respiratory bug that might be circulating. And I think that's probably the best strategy for someone who's on a disease modifying drug.
Um, Doctor, whenever someone asks me about Ocrevus, I always give your example to them that Dr. Darren Ingles has started taking Ocrevus and he's quite happy with that. So if you would like to share your thoughts on Ocrevus, how is it treating you?
Well, I wouldn't say I'm happy about it. I would prefer not. Well, for me, again, I hemmed and hawed for a while on it. I've still been very functional. And it's always hard when you're doing well to go on any drug. I think, when discussing it with my neurologist, because of my age, because I'm a male, I am at a little bit higher risk of more rapid decline based on the research. And the fact that I was feeling pretty good, I've kind of figured, well, I know enough, certainly as a doctor, in my own personal experience and professional experience, and how I can offset some of the effects of the medication. And I kind of said, I'll try it for a year, see how I feel, see if I want to continue thereafter. And so, again, I got my first infusion last summer. I'll get my second infusion next month, and we'll kind of see how it goes. I didn't really have any issues after the first infusion. They separate the first infusion into 2 infusions. They give you half dose 2 weeks apart. And I really didn't have any issue with that at all. It was the pre-medication, because Ocrevus in particular, causes allergic reaction in like 40% of the people. So they pre-treat you with steroids and Benadryl. And other than that, it made me extremely tired. That was pretty much the only adverse effect I had from it. So, again, I think I'm in a little bit different position because of what I know. Other people may not be in that same position, but I think, again, there are a lot of ways I know I can support my immune system, in and around the infusion to mitigate that. And, I'm not someone in my entire life that's ever been prone I've never gotten flu my entire life. I rarely get upper respiratory infections. My immune system's always been pretty hardy. And even so far, this winter, I haven't gotten any kind of illness at all. So, yeah, again, I think, if you're working with someone who can help give you guidance on, what to do to help support your immune system. I did see someone ask if what I specifically take for my immune system, and I'm happy to share. I take vitamin D. I take 10,000 IUs a day of vitamin D. Look, if you go to the beach here in California on a summer day, your body can make upwards of 100,000 IUs of vitamin D. It's clearly not toxic. So again, if you're taking high doses of vitamin D, it's a good idea to have your doctor check your vitamin D level, check your calcium level, make sure it's safe for you. But in over 20 years of practice, even at 10,000 IUs or more, I've never had a single patient have vitamin D toxicity. It just rarely happens. So I take vitamin D, I take vitamin C, I take 1,000 milligrams 3 times a day. I take 30 to 50 milligrams of zinc every day. I take fish oil every day. I take 6,000 milligrams. Now I'm 6'2" and 230 pounds. I'm a big guy, so I take slightly higher doses than the average person might take. But I check my vitamin D levels, frequently. My levels, even at a 10,000 IUs a day for my size, my vitamin D level is about 63. So it's not even that high. I could probably go higher. And what else do I take? Oh, I take cortisone.
So I know.
I
You take
know.
around 30 to 35 in a day.
I know. I take a ton of them. But for my immune system specifically, I'm kind of looking at my thing here. I do take cordyceps. Cordyceps is a mushroom that they use a lot in Chinese medicine. Cordyceps works great. I take coenzyme Q10. I take magnesium. Yeah, so I take a lot of pills every day, but it definitely helps. I take a sort of a handful of things to help support my immune system, and then the rest I take is really in the effort to rebuild myelin, and that's a different conversation. But yeah, that's what I do.
Thank you, doctor, for sharing this. This is very important. Doctor, related to the COVID vaccines once again, what is the difference between live and non-live vaccines? I just read that MS Society Ireland had mentioned in their website that most vaccines are safe for people with MS. Only live vaccines should not be used because they may provoke a relapse or a risk of infection if used with certain medications. Is that true? Have you heard about this?
Yeah, I mean, it kind of makes sense. Like a live virus vaccine, like influenza vaccine, you're actually giving a live virus. So, I mean, there's a chance that you can get, well, I should say some of the flu vaccines, not all of them. Some of them are, particles or attenuated. But when you give a live virus vaccine, you're giving the substance that can make people sick. So, in someone who's immune suppressed, there may be a risk of the vaccine accidentally causing the illness that you're trying to prevent. In a vaccine that's attenuated, which means it's been altered in a way that the organism can't reproduce, it can't cause infection, or something like hepatitis B vaccine, which is basically little bits of hepatitis B. It's not whole hepatitis B, it's bits and pieces that help stimulate the immune system. So it has no chance of causing hepatitis B, but it provides the material, enough material that the immune system can react to it. So in those type of vaccines, they are safer. But again, every vaccine, even the United States government says that, all vaccines are unavoidably unsafe for any number of different reasons. So, again, I think this is where you have to look at every single vaccine, every single individual, and make that decision about, whether that specific vaccine is right for you, given your age, the timing, and so forth. I mean, most of the vaccines that we give around the world are given in childhood to help prevent childhood illness. Once you're an adult, outside of influenza vaccine or maybe a booster for like tetanus, we don't really give a lot of vaccines. So that may be changing over time, but as of now, that's kind of where it stands. So, your risk of getting a live virus vaccine as you get older goes way down just because, and by the time people develop MS or most autoimmune diseases, you're out of that window, with the exception of like juvenile rheumatoid arthritis, that, you would be on those type of medications that might put you more at risk. So I think it's less likely that people are going to kind of run into that.
Okay. Doctor, I'm getting a few questions related to MS, not non-COVID questions. If you don't mind, can I just ask you those as well?
Sure.
Yeah, okay. So first question is from ms-diet PR. Please written, what is good for repairing myelin?
Well, there's a lot of stuff, and yeah, that might be a whole conversation we might want to do in another interview, because there's a lot of things that can help rebuild myelin. So, I mean, there's a lot of different herbs that show promise of rebuilding myelin. Cordyceps is one of them. Lion's mane is a medicinal mushroom I'm very excited about, and I'm actually in the process of developing a new supplement that has lion's mane, mostly for Lyme patients, but I think it will help MS patients too. So, we know from at least animal research that it has the capacity to rebuild myelin. So there's evidence that biotin, high-dose biotin, can help rebuild myelin. We think fatty acids help rebuild myelin. Gosh, there's a lot. So yeah, that might be a better for another discussion where we can go through kind of individually and talk about things that help rebuild myelin. But yeah, lion's mane and cordyceps, I think, are two off the top of my head that I think show a lot of promise. Now, understand, rebuilding myelin, I should make this point, is a slow process. Under the best of circumstances, it's years. So people go, well, I've been taking this supplement for 6 months. I don't feel any different. I'm like, well, okay, take it for 6 years, and then let me know how you're doing. So don't expect an overnight wow. That's not the way it works. And depending on the extent of damage in your brain and spinal cord, if you have MS in particular, it may take years to rebuild that myelin to the point where it builds to a level where you feel more functional, or your brain has rewired around those scars, those lesions, so that you are functionally better.
Right. I have another question by Saab, and she's written, what's the difference between active and non-active lesions? When I was first diagnosed, they said my lesions were non-active.
Well, an active lesion means there's active inflammation going on in your brain or spinal cord, and that's much more serious because when it's active, and that's what all these disease-modifying drugs are really designed to do, is to shut down that activity. We want to shut down that inflammation to stop the damage to the brain and spinal cord. So the concern when you have active lesions is that that inflammation's ongoing, and which means it can get worse. When it's non-active, that means that the inflammation is not active. At that point, it may be residual scars in the brain or spinal cord, which is a better sign. I mean, the damage is done, but at least it's not continuing. So, when people get their repeat MRIs and they see that their lesions are non-active, usually the report comes back is that they kind of look the same as it was last time. There's no evidence of activity. The disease is stable. And that's good in many ways because we don't know that we can completely repair the scars that are there, but we do know that you can rebuild new neural networks around those scars so that you are functionally better. So when I see people with MS who improve, now I've had patients where their lesions have actually gone away. When they get repeat MRI, they don't see the lesions anymore. I mean, that is possible. But I think what happens more often than not is that we're just circumventing those lesions and creating new neural pathways so that we are functionally better.
Doctor, I can see a very, very important question here. So since it's winter times and viral infection is also ongoing and people are actually mixing viral infections with COVID, they are scared what they have. So there's a question by MS Warriors and said, Doctor, what's the main difference between a regular viral fever and COVID? How can we know? What do we have?
It's very hard. I mean, clinically, they can look the same because a lot of people who get COVID-19 get a bad cold. And unfortunately now, every time someone gets a cold, low-grade fever, a cough, they just automatically assume it's COVID-19. Well, there's a million other viruses. There's still influenza virus, there's still rhinovirus, which causes colds. There's adenovirus, there's enterovirus. So there's a whole bunch of other bugs out there that can cause similar symptoms. My opinion and what I do with my own patients is that if they have these symptoms, I get them tested anyway. Let's make sure it's not COVID-19 because we might treat that a bit differently. But if it's just a run-of-the-mill, virus, there's other things we can do as well. And there is a lot of overlap. I mean, coronavirus is a virus, and a lot of things we do for rhinovirus and adenovirus is the same. But I think with COVID-19, because of that potential to cause more serious illness, I'm a bit more aggressive in how I approach it.
Yes. Doctor, there's one question by Asher, and he's written, I'm being asked to use Tecfidera, dimethyl fumarate, as a treatment, and is it safe?
Is Tecfidera safe or to getting the vaccine with Tecfidera?
Is it, he has been asked with it, yeah.
Yeah, I mean, Tecfidera is a different mechanism of action. So I think out of all the medications, I think people who are on Copaxone or Tecfidera are probably at much lower risk than people who are on Tysabri or Ocrevus, some of these other drugs that have a more, I think, immune suppressing effect. So we don't know for sure, but based on the mechanism of action of what these medications do, I would be less concerned on someone on Tecfidera.
Right. Doctor, I have a question here by MS Lex. She had sent me prior to the session that I'm fit and well MSer and on no DMT. Will this be safe for me to take the vaccine since she has also never taken a flu shot? And she's just concerned only about the long-term effects of the vaccine.
Yeah, I mean, in terms of the short-term safety, outside of the allergic reactions we've been observing, probably. But again, we don't know what the long-term effects are because it just hasn't been studied. So unfortunately, it's a question mark. We really don't know.
So it actually depends on us whether we want to take the vaccine or we don't want to take the vaccine, and then we have to consult with our doctors. Yeah. Doctor, when we talk about the vaccine, in this vaccine also, there are 2 doses and in the gap of 21 days. So how was this 21 days decided? Why is this gap fixed?
Well, the dosing schedule is based on what the initial research was based in animal studies. At what interval do you get the best immune response? So it looked like, and with the one shot, you get almost like a 40 to 50% immune response. And after the second shot, they get it up as high as 95%. So that dosing interval is just really based on the animal research, and what they found seems to give the optimal level of antibody response.
Okay. Talk to this. One more question which I have here. It is about interferon beta. So when the studies were being done for COVID vaccines, they also considered interferon beta 1A to be one of the medicines for COVID vaccines.
Yeah.
But we did not get any follow-up results of that. Do you have any idea of what happened to that study being done then?
Nope, I haven't heard anything either.
There was a hush hush later on, and earlier people were very excited. Oh, we are interferon, we
Yeah.
are safe. And then there was complete silence after that.
Yeah, no, I haven't heard anything.
Okay. Doctor, okay, so there's one more concern when it comes to MS and COVID, is that there are different kinds of MS, RRMS and SPMS.
Yeah.
Has there anything been seen or observed till date that RRMS people get less of infection and SPMS gets more? Anything, this kind of study which has been done ever?
Yeah, well, there's certainly no study that's been done. And anecdotally, I was actually just on a call with Terry Walls not long
Okay.
ago, and she was talking
Wow.
about this. And yeah, it didn't sound like there's been any observable difference between what type of MS you have. Again, I think it
Mm.
has more to do, again, with whatever medication you're on, plus all of your other comorbid factors. So it probably matters less what type of MS you have. It probably has more to do, again, with whatever DMD you're on, plus all your other comorbid factors.
Doctor, looking at the situation now outside, since the entire world is going into lockdown again, and the vaccine has come, but people are very deceptive to, I mean, they are just confused whether to take it or not. What do you think? How long will this situation go? I have a question like this.
Yeah.
Yeah.
Well, like I said, I think what's going to happen, if history, repeats itself, is that, the virus will eventually burn itself out. Once we get to a certain threshold of herd immunity, it's got really nowhere to go anymore. And, we used to think that you needed 60 to 80% of the population to get exposed to get herd immunity. But when you look at some of the research, it suggests it's probably around 20%. It's much, much
Right.
less. So when we hit that threshold, whatever it is, the virus will basically kind of peter itself out. And we do know that, they've been tracking the genomics of this virus. It's already mutated, plus we've heard about this new variant that's come
Yeah.
out of the UK.
I
We
have
now have it in the
spoken
US.
to,
It's
yes.
not any
Yes.
more lethal. It's just a bit more contagious.
Yeah.
So, this is the nature of viruses. They mutate, they change, and some of them do it very quickly, like influenza, and some of them are much slower to do it. So again, I think what will probably happen is that the virus will mutate itself, or will reach that threshold herd immunity where it just will stop. It won't be as virulent, causing the kind of problems that we've been seeing, and that may coincide with about the time that most of the general population would have that vaccine available. So I think at that point, it's almost like, well, you kind of have to just figure it out with you and your doctor about is it worth it at that point to get the vaccine for a virus now that's on its way out the door, not as virulent, not as potentially lethal. um,
Mm.
and let's see. Again, my feeling is that they will probably have to come up with a new coronavirus vaccine each year, like influenza. If this virus mutates the way that it kind of looks like it has been doing, by the time next season rolls around, it may look genetically quite different, in which case we don't know the vaccine they're giving now will provide any immunity for what comes down the line. Because we know it doesn't happen with influenza. Every year you've got to change it, and we're always speculating about 8 or 9 months out about what's going to show up, and inevitably we're wrong because of that rapid mutation. So whether this SARS virus will have the same capacity to do that, we'll just have to see. But since we started tracking it genomically, for about a year now, we have
Mm.
seen it's changed quite a bit.
Yeah, because we have seen that in UK there was some news which had come that in UK there was a mutated virus, and this vaccine is not working on those viruses at all. So it's just useless for them. And in fact, people who have taken the shots, even they are getting coronavirus. So it's just a very confusing situation for everyone.
Yeah. Yeah,
Doctor, sorry.
as much as we've learned in the last year, there's still so much we don't know about the virus. And again, as much as we know about coronaviruses, there's still a lot we're learning about SARS-CoV-2. The reality with any pandemic is you really don't know how bad it is until it's over. And then you can go back retrospectively, look at all the data, look at what really happened, and then have a clearer picture about kind of what happened. And we know this what happened when swine flu came out in 2009. It was 4 years after that they published a paper that showed how bad it really was, who was impacted. It just took that long to cull all that data and kind of put it together. So, we'll learn more about it, which hopefully will help us with the next pandemic and how we manage it and treat it. But in the meantime, we're kind of are where we are. But I think the encouraging thing is that, we're probably getting closer to that time where this virus will naturally start to either mutate its way out or will hit that herd immunity threshold. And hopefully at that point, we'll see less cases, less hospitalizations, and certainly less death.
Talking about the other viruses, India is now also having the bird flu virus, which is already spread across India. So now we have coronavirus and bird flu virus to fight with.
Yeah.
It's a very difficult situation here.
Yeah. And it's interesting because in the United States, we've had no flu. Influenza we've had hardly any cases. I have a colleague here who's a pediatric cardiologist at our local children's hospital, and he's like, we've had no influenza cases. And usually our hospital's full with flu cases. Now, granted, people are stuck indoors, they're wearing masks. I mean, people aren't really around each other, so it makes a little bit of sense. But still, influenza is still usually infectious enough that if we're still seeing people getting coronavirus, I would still expect people to get influenza. And we know that flu vaccine distribution has been way down because nobody's going to the doctor either. So it's kind of curious that all of a sudden we're not seeing any influenza.
Let all the diseases in the world just shut down. Nobody wants to get ill either.
Yeah.
Okay, I have this follow-up question from MS Warriors, and he's written that my temperature comes and goes all day. Sometimes it's 99.5, sometimes it's 101, sorry. So is it COVID or is it viral?
You got to get tested. There's no way based on temperature alone that you can tell. My parents both got COVID-19 in the last 2 weeks. Both of them had a very low grade temperature. They had no respiratory symptoms. My parents are in their mid 70s, and they both got through it in about 3 days. Fortunately, they don't have any other really comorbid conditions, and other than age, they're reasonably healthy people. So, it's.
But how do they even come to know that, I'm having this symptom and I should get tested when they don't have any fever, no respiratory? Then why to get it tested at all?
Well, in the United States, most people, if they're not symptomatic, they're not getting tested. We're not generally testing people who aren't symptomatic. So how many people out there are asymptomatic and have been exposed? We don't know because we haven't been testing that population of people. Now, I think more and more people have been tested just to kind of find out. Definitely, we are doing more testing now than we were, 9 months ago. So the number of cases, of course, have gone up because we've tested more people. That's called a case-demic, and that happens around the world. But it's interesting. I mean, the good news is too, even though we're seeing this spike in cases, we're still nowhere close to where we were back in, April, May, June, where, we had, there were 1,000 people a day dying in the United States. Even though we've seen the spike, we're nowhere close to where we were, 8, 9 months ago. So that's the good news. But yeah, it's still obviously a problem. But I think, if someone's got a low grade fever, if you're getting, flu-like symptoms, it's advisable to get tested for COVID-19 to know, because again, your intervention would be different potentially than if it's just regular influenza.
Right. Thank you, Doctor. Doctor, I'll just take the last question since we have already been speaking for around 1 hour now. So the last question I can see is by Gitav, and he's written, what kind of diet are you on?
I'm on Dr. Wall's diet. I follow a level 2 diet. I am not fully keto. I probably should be, but I'm not. So I follow level 2 of her diet. Okay. Yeah.
So Dr. Wall's diet, which is, I know that it's one of the most famous diets, and many people actually are on it, they are following it, and they have really recovered a lot from their symptoms. Okay. Okay, doctor, thank you so much for this wonderful session. And thank you for always being there and helping and supporting us in all the things that we do here. Thank
Of
you so
course.
much.
All right. Thanks, Ritu. Okay. Bye
Thank
bye.
you, doctor. Have a good day.
You too.
Bye. Thank you, everybody, and a special thank you to Dr. Darren Ingles, who, on your request, actually we invited him for this session, and he agreed to do that. We have learned a lot about vaccines, the COVID vaccines, and MS, and he has given a lot of insights and the knowledge that we needed to have. Well, I hope you guys like the session. And yes, if you have any flu-like symptoms or any problems, please get it tested. And I could see there were many people who were still asking if they could take the vaccines and Zentai or they are in other kind of DMTs, Lemtrada or anything. The answer to that is, as Dr. Engel said, that you have to consult your doctor. Everybody is different. So please consult a neurologist and ask if you can take the medicines or not. The vaccines or not. All right. So have a good day, and please follow Dr. Darren Ingles on his Instagram page. He also has a wonderful website. He also posts wonderful recipes of healthy diet. I think you should follow him, and also stay tuned for our podcast. Dr. Ingles is also as a special host, a special guest in many of our podcast sessions. So stay with us for further sessions. And if you want any specific topic to be discussed, like you requested for COVID, please message us and we'll look into it. Thank you so much, everybody, for joining us. Have a good day or have a good night for some of you. Bye-bye.